Hi there, my name's Sam Clark from the Movement Studio and the Spinal Recovery Program. And if you've got low back pain, if you've got persistent or recurrent low back pain, then today I'm going to show you the Pain Recovery Pyramid. And this is particularly relevant to people who have been told that their pain is underpinned by any of the following things. Things like muscle dysfunction, or if you've had surgery, if it's post-surgical and you're still getting problems, or if you've been told that your pain is due to disc degeneration and you might have been shown that on an MRI scan, or if you've been told that you've got sacroiliac joint dysfunction, or you may have even been told that you've got just age-related change and there's nothing that can be done about your pain. If you recognize any of those things, if you've been told that your back pain is due to any of those things, this is especially relevant to you. So why should you listen to me? Well, I studied for 5 years in formal education, ending in a master's degree, where we focused on the evidence-based and safest and most effective approaches for diagnosing and treating pain, including back pain. After that, I then studied for another 5 years in continual professional development, where I focused my attention directly onto low back pain. I spent time with pain specialists, I spent time with physiotherapists, GPs and other chiropractors, learning all about low back pain and the best approaches to dealing with it long term. Probably most importantly, I've lived with chronic pain myself. For 4 years I struggled and was on a pain medication cocktail, like the one you see here at the top of the pyramid. I was taking amitriptyline, I was taking duloxetine, naproxen and tramadol, and I spent many nights lying in bed worrying about my pain and scrolling through pages on the internet and research articles and studies in a hope that I would somehow find a way to cure it. And it was only once I started really implementing all the things I've been learning over the years that I got good results for myself long term. I then applied those things to my patients and they've been getting fantastic results as well. So the first thing we need to do as healthcare professionals when someone comes to us with persistent or chronic low back pain is diagnose them effectively. We need to establish that they are not in medical danger. Now, over 99% of back pain cases are due to things that we can change, things that we can influence and control to help our patients in both the short and the long term. But about 1% of them are down to things that are medically serious or dangerous. And it's up to us to ask the right questions and listen very carefully to what our patients are telling us to figure out which group they're in. Now, hopefully you're in that 99% group and the overwhelming chances are that indeed you will be. So once we know that, it's time to look at where you are on that pain recovery pyramid. So many times when patients come to us, they're at the very top. You know, they're thinking about surgery or maybe they've already had it, or they're taking a pain medication cocktail similar to the one that I was on. Now, the issue with these things is that they don't provide us a long-term solution for managing and controlling and overall recovering from our back pain. You know, they have a high level of risk and really a low level of reward. The effects of the pain medication can eventually start causing as many troubles as they are attempting to solve. If they're at the middle part of the pyramid, this middle section, then maybe a patient is thinking about steroid injections, where we take a needle and inject steroids into the back. Or maybe they're thinking about radio frequency ablation, where we target specific nerves in the back in a hope that that will improve our patient's pain. Perhaps they're just caught in a cycle of endless procedures, medical procedures, or they've become dependent on pain relief fads and gadgets that you see advertised on the internet. Really, when someone comes to us, it's our responsibility as healthcare professionals to guide them as safely as possible and as quickly as possible down to this bottom level, where we can begin to focus on the things that really empower patients to take control of their pain when they're not seeing us in the office. That's things like movement rehabilitation, that's things like proper pain-centered mindfulness and pain recovery mindset and education. You know, busting the myths on the culturally ingrained beliefs that many of us have about our pain that ultimately don't serve us and in fact slow our recovery down. So what should all these things do? They should be combined in a program that applies to you and your back pain. The first thing we need to look at in this program of recovery is making it personalized. You know, every recovery program needs to be able to adapt to the specific needs and lifestyles of the patient who it's applied to. We must have a good level of understanding of our patients and teach them how to make these recovery solutions apply directly to them and their own lives. The second thing that our program must do is aim to restore your ability to function, and it needs to rebuild the trust that you once had in your back's capacity to carry you through life. We want you feeling confident in your back and not worrying that at any moment it could let you down. The third thing we need to look at is making sure everything is underpinned by the best clinical evidence available on back pain recovery. It's no good me as a healthcare professional, someone who should be really up to date and informed on all the latest ideas around back pain recovery, just giving my patients what I think they need. No, I should have spent the time to research and gather information on all the best solutions for my patients and then deliver that to them in a succinct and simple way so they can start applying it from the moment they leave my office. The fourth thing our recovery program or our recovery approach needs to cover is it needs to give our patients the ability to customize their whole recovery and spot the things in their life that have been influencing their back pain so that they can control it and it doesn't control them. There's really not a whole lot of point in taking an exercise sheet from someone or going to the same exercise class every week, week in, week out, and just doing the same thing over and over again. That's not making an adaptable program. That's not meeting the body where it is right now. It's all about understanding that our approach should be adaptable and it should be personalized for the person in front of us with back pain. That's you. So if this has helped you get a better idea about how to manage your own back pain and understand where you might be in the pain recovery pyramid, fantastic. We want you to be feeling like you've got options which give you less risk and a high reward potential to recover from your pain long term. If you'd like to get in touch with us, you're more than welcome. You can get in touch and we can set up a free clinical consultation where we will discuss with you the best options for your back pain recovery. Again, my name's Sam Clark with the Spinal Recovery Program and the Movement Studio, and enjoy the rest of your day. Wait, don't go just yet. If you found that content useful, then join our brand new Facebook group, Low Back Pain Recovery, and feel free to add me personally on Facebook as well. Again, my name's Samuel Clark, and in the picture, I'll be wearing this t-shirt. And of course, don't forget to like and subscribe to this channel, the Movement Studio programs. That's all for me. Again, my name's Samuel Clark from the Movement Studio and the Spinal Recovery Program, and enjoy the rest of your day.